everyone, good afternoon. My name is Eunice. I'm a doctor from the Department of General Medicine from Tan Tock Seng Hospital. It's great to meet everyone here, and I'm very excited to be here today on the National Civil Academy e-Nuggets series, and I'm sharing about planning ahead advanced directives in Singapore. For myself, I'm one of the clinical co-leads in advanced care planning in Tan Tock Seng Hospital. So I hope today that you'll be able to learn about the various ways you can plan ahead for yourself as well as for your loved ones. So this is the outline of my talk today. Why do I need to plan ahead? What kind of decisions or plans do I need to make? What are the different ways in which I can plan ahead and how to get started? At the end, there's also a mini quiz. And also, if you have any questions or comments, you can always type in the Facebook comments page, and we will be answering the questions at the end of the talk. So first of all, to start, why do we need to plan? So in life, actually, we make lots of plans. You may not be aware of it, but I'm sure you make plans in regards to, for example, the place that you're staying at. You probably make plans with regards to how much money you need to set aside for the payment of the house. You probably make plans in regards to travel overseas previously for your holidays. And I'm sure you also make plans in regards to what courses you wanted to study when you were younger, or what jobs you decided to take after you graduated. And of course, in regards to our life stages as a human being, you know, we make plans in regards to who do we want to marry, when do we want to get married, how many children to have, when to start having children. All these things, I'm sure all of us did some planning ahead. So in regards to growing older, developing illnesses, and subsequently passing away, these are things that is part and parcel of life, right? But not many people actually stop and think about what life is going to be like in the future when we get seriously ill. But I would like to put it to you that actually it's really important to plan ahead for these kinds of things, because when we plan ahead, we have less stress, not just for ourselves, but importantly also for our loved ones. So these days, actually, there's lots of medical advancements. We have advancements in terms of the technological capabilities to make drugs, okay? And there's definitely a lot of advancements in regards to making of antibiotics. Last time we only had penicillin. Nowadays we have so many types of antibiotics to treat the more resistant bacteria. We also have so many advancements in regards to treating conditions that used to not be treatable. For example, in that picture, you can see that there's a picture of a blood vessel and a metal stent put inside it. And that's something that we usually do in regards to a coronary artery disease, or what we call as a heart attack, right? So these are lots of advances that thankfully we get to enjoy in this day and age. And in terms of surgical advancements, there's also so much progress that has been made. Previously, surgery, involved a huge team of doctors. And nowadays, there's always the option of robotic or even remote surgery being done. So that is really quite a lot of advancements that we've made so far in regards to modern medicine. And of course, in regards to support of organ systems in a critically ill patient, these are things that we've also made incredible advancements on. We have machines that can take over the role of a kidney function, for example, in terms of dialysis. And we also have machines that can take over the work of breathing or even the heart beating in a human. So these are great modern advancements that we have managed to achieve. And yet, I would say that all of these advancements, although yes, they are really very, very good, they have definitely prolonged the lives and make people live longer. But at the same time, there is a downside to it, in the sense that people are living longer with these chronic illnesses, and sometimes this also results in some impairment of their function, some impairment of their quality of life. And over here in this picture that I've gotten from Netscape, you can see that it's an elderly person who is being supported by a lot of different machines. And unfortunately, this is something that is really quite common that we do see in our hospital, where we do have lots of, we do have patients who are being supported on machines to support their breathing and their heartbeat. And unfortunately, this results in quite a lot of suffering, prolonged suffering, I would say. And this is something that modern medicine has managed to achieve because we have been so successful at keeping people alive. However, even though modern medicine really has made so many advancements, in terms of the various things that I've just shared with you, at the end of the day, really, modern medicine still has its limitations. I mean, we are all living in a very unique period at this point in time with the coronavirus pandemic. Okay, and we know that no one is immune to serious illness. Okay, we can see that there are cities being on lockdown, and also there are so many deaths occurring in other countries where the healthcare system is a bit more fragile. And all this is because modern medicine has its limitations. So no one is immune to serious illness, and in spite of the advancements of modern medicine, there are still limitations that we face. So everyone is immune, everyone is susceptible to serious illness. It can happen to anyone at any point in time. And I think it's during this coronavirus that we can really feel it and see it more apparently. So I'd like to share with you a true story in regards to this whole history of advanced directives, advanced planning. So this happened back in the 1990s. Miss Terry Schiavo, she was a 26-year-old lady from Florida, USA. And what happened was that she suffered from an eating disorder, and she developed this condition called hypokalemia, which is very, very low potassium, because she was not eating at all. And this resulted in a cardiac arrest. She collapsed at home. And her husband, thankfully, was there. He called the ambulance. But unfortunately, by the time she was brought to hospital, she was diagnosed to have very severe brain damage, and subsequently diagnosed to be in a permanent vegetative state. So this was a very, very unfortunate thing to have happened to a very young lady. So her husband actually tried very, very hard to help her to recover. He brought her to many specialized treatment facilities, to try to get her to go through various types of therapies to see if there was any chance at all for her to recover. He himself also became a trained therapist so that he could aid in her recovery. However, 8 years passed and Miss Terry didn't improve at all, and her husband decided to file a legal petition to have a feeding tube removed, because he said that his wife isn't improving. It's been 8 years, and he felt that based on what he knew about his wife, she would not want to be artificially kept alive in such a situation. However, Miss Terry's parents, they contested the decision against the husband's plan to have the feeding tube removed, and the case was brought all the way up to the courts. Okay, and this was a period that it was actually, there was lots of media coverage. There were people taking sides of the husband. There were people taking sides of the parents. There was a lot of interviews, a lot of protests being done, and you can imagine the amount of trauma, the amount of stress both the parents and the husband went through. Okay. At the end of the day, the courts ruled that the husband was aware, and he represented what Terry really wanted. So the courts ruled that it was okay for the tube to be removed on March 18, 2005. You can see that was really quite a long battle that the parents had with the husband. Okay, and she subsequently passed away 2 weeks after the tube was removed. It's such a tragedy because this incident of this young lady, suffering from such a severe, irreversible brain injury. That itself was a tragedy, and on top of it, the conflict between the husband and the parents subsequently was also something that was really quite upsetting. So this story that I've just shared with you, it emphasizes the need to plan ahead, because we want to avoid this kind of situation where our loved ones are in great conflict. And we need to plan ahead because although not many of us will have a sudden deterioration like Terry Schiavo, where we suddenly overnight lose the ability to talk, or to say what we want. Most of us will pass away from a chronic, progressive, and ultimately fatal illness. And this is in part because of the advances of modern medicine. We have the ability to really prolong people's life for quite a bit. Okay. And when the time comes to make important end-of-life decisions when we are really quite ill, almost 50% of patients are not capable to participate in these decisions. Sometimes it can be that, they are very ill, they are very tired, so they are not able to take part in the discussion when the doctors come to them to discuss with them, what is important at that stage. And if it comes down to the healthcare professionals to make the decisions, we as healthcare professionals, sometimes we are also quite uncertain about what would be the best thing to decide, and the default would be to treat. And of course, this is sometimes good. We should definitely be treating most of the time, but there are certain situations where the treatment actually, brings about a lot of suffering, a lot of burden to the patient, and without any meaningful benefit. So in those kind of situations, treatment may not necessarily be the best thing. And if caregivers or family members have not spoken to a patient about end-of-life issues, unfortunately, studies have shown that they are unable to reliably predict what the patient would have wanted. In fact, there was a study done where they compared what the patient wanted versus what the loved one guessed the patient would have wanted. The loved one, actually, they only managed to predict about 2/3 of the time correctly. So that's not a situation where we want to have, where our loved one has to guess, and sometimes they may end up making the wrong decision, not what we would have wanted. So this is a cartoon to show what happens most of the time in the hospital when we have to talk to patients when they're very ill. They are often drowsy, they're not able to have the conversation. And then when we turn to the family members to ask them what the patient's position is in regards to certain treatments, this is the usual answer that we get. They'll say that, oh, we never really talked about this kind of thing before. And then it becomes very stressful, very difficult to decide what is the next best thing to do. So the benefits of planning ahead is that it gives you choice, it gives you control, it helps you decide, what are the situations in which you would want treatment to be carried out for you, what are the situations in which you feel that you just want to be comfortable and you do not want invasive or painful things to be happening to you. Okay, and it ensures that your wishes and values are respected. It is an opportunity to strengthen the relationship between you and your doctors, because we as doctors, we do want to know what is important to our patients so that we can make the right decisions on their behalf if the time comes. Okay, and definitely there's a lot of relief burden on loved ones when they know what we want. There's also we can also avoid conflict and confusion amongst our loved ones if we plan ahead and we share with our loved ones what we want for ourselves. When we do advanced care planning, it's also a very good time to strengthen relationships with the loved ones, because that's when the patients can share, things that they are so thankful for, things that they appreciate about their family members or their loved ones, and it is a very good conversation that we have between the patient, their family member, as well as the medical team. So I have here some examples of the kinds of decisions or plans that we need to make. It's not exhaustive, but I think it probably can be sort of like a trigger for you to start thinking about these questions. How would I want to be cared for if I'm seriously ill? How would I want to be cared for if my condition is critical and irreversible? Okay, so these are two different things. One is seriously ill. One is if the condition is very serious as well as irreversible. Okay, who can be my spokesperson if I cannot make decisions for myself? So think about it amongst the people whom you care about or who care about you. Is there someone that you feel knows you well and can be your spokesperson if you are too ill to talk? What is important to me if I'm unable to care for myself? What are the things that you value? Are you the kind of person that does not mind, having someone to be bathing you, to be looking after you all the time? Or is independence something that is super important to you? These are things that is very unique to every individual. How would I want to distribute my assets? I think this is something that most people think about when we bring up the topic of advanced care planning. They only think about their finances and their properties and the things that they own. But actually, there's a lot of other health decisions that people usually do not think about. Okay, how would I want my funeral to be like? I think this is something that some people, they do think about. They want to plan ahead. I recently had this church auntie. She planned ahead in regards to how she wanted her funeral to be like. She picked up the location. She decided what flowers she wanted, what kind of picture she wanted to be used, and in terms of the music to be used. I think all these things are part of the memories that she wanted to leave behind for her loved ones. Okay, so that's a question that you may also want to consider. So you can see all these are very complicated, very complex decisions to make. There's no one single answer, and it's very different for, every individual has their own different thoughts about what is important to them. And think about how stressed and burdened our loved ones would be if they had to make all these complex decisions on our behalf without knowing what we wanted. So now I'd like to briefly share with you what are the different ways in which you can plan ahead. I'll be going through 3 of them in greater detail in the subsequent slides. So there's the Advance Medical Directive, the Lasting Power of Attorney, Advanced Care Planning, CPF nomination, and making a will. So for Advanced Medical Directive, or otherwise known as AMD, it is one of the older advanced directives that we have in Singapore. It is a legal document, okay, which means that it is recognized by law. And when you sign an AMD, it means that you do not want your life to be artificially prolonged in the event that you are unconscious, terminally ill, and dying. So it has to fulfill these 3 aspects. You need to be in a state where you are unconscious, when you are terminally ill, and when you are dying. Okay, and this form, the AMD form, when you decide to make it, you sign it in the presence of 2 witnesses, one of which must be a doctor, because the doctor needs to assess that you understand what you're signing. And the witness can be anyone. If you want to go to the clinic with your family member or with a friend, that's also okay. Or if you decide to go to the clinic alone, the doctor can get one of the clinic staff to also be the second witness. The form only comes into effect when the patient is certified to be terminally ill, irreversible, and dying by 3 individual doctors. So you can see this is a form that only happens, that only the effect kicks in only when it satisfies that criteria. Okay, and you need to be assessed by 3 individual doctors who all agree that the patient who has signed the AMD is indeed terminally ill, unconscious, and dying. Okay. Doctors will not know that you have an AMD unless you tell them. Okay, so this is something that you can make, but if you did not tell the doctors that you have signed an AMD, they will not know. An AMD can be made at a GP clinic, a polyclinic, or a hospital, and you can easily find the form online. So as for the LPA, the Lasting Power of Attorney, it is also a legal document. Okay, and what happens is that when you make an LPA, okay, you yourself, you are the donor, you want to legally appoint someone else called the donee to help you make decisions on your behalf when you lose your mental capacity. So this is different from the AMD because the AMD only kicks in when you are terminally ill and dying as certified by 3 doctors. But in this case, the LPA kicks in when you lose your mental capacity. So you may not be terminally ill at that point in time. It's just that for some reason you are not able to make decisions. For example, you may have a stroke, you may have dementia, or perhaps you have some confusion due to acute illness. And when you lose your mental capacity, that's when the person that you have legally appointed, the donee, can make decisions on your behalf. So the person that you have decided to appoint will make decisions regarding your personal welfare, so things in regards to where you live, who visits you, regards to your health matters as well, and or your financial matters. So you can appoint a person to just be making decisions with regards to personal welfare only, or your financial matters only, or you can ask them to make decisions in regards to both matters. The choice is up to you. However, there is a limitation in regards to the type of decision the donee is able to make. If the decision is regarding life-sustaining treatment or treatment to prevent a serious deterioration of the donor, okay, the final decision is not by the donee, even though he's legally appointed. The final decision will be made by the doctor. Okay, but the doctor, of course, will discuss with the spokesperson or the family members of the patient because they want to make sure that what they're doing is really the best for the patient. So the doctor will usually discuss it with the family members of the patient, but the final decision is still by the doctor, not by the legally appointed donee. So this is a restriction of the powers that the donee has. They can make all sorts of decisions on behalf of the donor, but in regards to decisions for life-sustaining treatment or treatment to prevent a serious illness, serious deterioration, that decision will be made by the doctor. The form, like what I said, comes into effect when the donor loses mental capacity. So doctors also will not know that you have nominated an LPA unless you tell them. Okay? And the LPA form can be made by a doctor who is accredited, a lawyer, or a psychiatrist. And the form is also found online. And I just happened to find out that there's a fee waiver if you decide to apply for the LPA, and this fee waiver is actually extended to March next year. So if you apply for it, the application fee itself will be waived, but in terms of the fee for getting the doctor who's accredited or the lawyer or the psychiatrist to see you, that's a separate charge altogether. So next, we come to advanced care planning. And so advanced care planning is quite unique. It is the most recent advanced directive, advanced plan that Singapore has, AMD being the very first, then subsequently the LPA and ACP was started around 2000. So ACP, it refers to a series of conversations that's held between the patient, the family, and the healthcare team. So it's not just a one-time sort of form that you fill up, unlike the AMD and the LPA. And in advanced care planning, the person or the patient shares their personal values and beliefs and makes their own decisions on future healthcare preferences. During the advanced care planning session, you can also nominate a spokesperson to speak on your behalf if you lose mental capacity. So it's quite similar to an LPA in that you can appoint someone, but this is not legally recognized, but still it is someone that the doctors can know who to consult with to find out more about your values and preferences if they know you have nominated a particular person. Okay, the advanced care planning form comes into effect when the patient loses mental capacity. So when the patient is not able to make decisions on their own, the doctors will refer to the advanced care planning form that the patient has done, and from there they can see who the patient has nominated to be their spokesperson and what kind of values and beliefs or healthcare preferences the patient has decided beforehand. This advanced care planning form, the main use of it is to help provide guidance to the medical team to make healthcare decisions on behalf of the patient based on the patient's values and preferences. So although at that point in time, the patient has lost mental capacity, cannot make decisions on their own, the advanced care planning form is like a representation of what the patient wants. And the form really helps to guide the medical team to make sure that they are making the decisions that are what the patient would have wanted for themselves. The ACP form, when you have filled it up, it will be uploaded to the National Electronic Healthcare Record, or what we call NEHR. And for those doctors in the government hospitals or clinics or polyclinics, if they have the NEHR record, they will be able to see your advanced care planning form. So it is quite visible compared to the AMD and the LPA. And an ACP form can be filled up together with facilitators who are trained. They may be doctors, nurses, or social workers. And that service is easily available at GP clinics, polyclinics, counseling centers, and of course in hospitals. So personally, as a doctor, I do think that for the various advanced directives, they all have their uses. Okay. However, I would say that advanced care planning is more useful really to help healthcare teams make decisions according to what the patient would have wanted. It is more meaningful because it also shows the healthcare team what that individual person's values, beliefs, and preferences were, and it helps us so much to make decisions individualized and tailored according to what that patient prefers. Okay? It also helps the medical team to understand what living well means to the person as an individual. And during that process of ACP discussion, it usually has the nominated healthcare spokesperson there as well. So that can be, for example, your spouse or your adult child, okay, or a very close friend. So during that discussion where the facilitator is having the ACP discussion with you, your spokesperson is also there to hear what you have to say. So they will definitely know what you want. As compared to an AMD and an LPA, where you may be signing the form just with the doctor alone, the person that you have appointed is not there, then that will be quite challenging for them when it comes to the time where they have to make decisions on your behalf. Okay, so now what I'm showing you is a screenshot of the Living Matters workbook. Later I will show you where to find it. And you can see some of the questions here are really quite interesting and very meaningful. And they're trying to draw out the various values and beliefs and preferences that an individual has. Okay, so you can see certain questions that's trying to draw out your own feelings in regards to death and dying. Okay, or perhaps in terms of what does quality of life mean to you? What does living well mean to you? For example, in the bottom corner, you can see they ask, what are the most important aspects of your well-being? So this is very individualistic, right? Some people, they can say that being able to walk and move is really important to me. Some people may say that being able to talk and be close to my loved ones is really important to me. And all these things is very individualistic, and that's how we as the healthcare team can really get to know the patient as an individual. So this is another slide to show the Living Matters workbook. So you can see the types of questions that you're asking pertains to the person's wishes in regards to their healthcare decisions. So for example, my greatest fears and worries about having a serious illness are, for some people, they'll say pain is something that they are really worried about, financial burden or not being able to move, the lack of freedom. These are questions to find out what is the most important to you as an individual if you were to get seriously ill. Okay. So just to share a bit about, if let's say you've started to think about who you want to nominate as your healthcare spokesperson, think about a person who is willing to represent your voice during a medical crisis. That means they are willing to respect what you have decided for yourself. They will not put across their own wishes on you. They are willing to follow your known care wishes as much as possible, even though sometimes these decisions may be quite challenging, but they are willing to respect and follow through with what you have decided. They know who you are, they know your preferences, values, and goals, and they must be able to make decisions even under stressful situations. Okay? You can ask more than one person if you want, but it's always better to make sure that both parties, whoever that you've asked, both know your wishes well. Okay, so this is just a slide to show how advanced care planning can be done. Think about it, okay? Talk with your loved ones, put your wishes into a plan. Okay, you can use the advanced care planning workbook, and if you want to formalize it, you want it to be uploaded to your national electronic healthcare record, you can get in touch with one of our trained facilitators, and they can get the form filled out with you, and it can be uploaded to your electronic health record. And subsequently, along the years, if your preferences change, circumstances change, you can always change your mind and update your ACP as well. Okay, so just a quick table to show the differences again between ACP, AMD, and LPA. I know it can be a bit confusing, so I'll just go through it again. So in advanced care planning, what it is that it enables people to know your treatment preferences, and it involves a certified advanced care planning facilitator. It comes into effect when you lose the ability to make decisions for yourself. Okay? For Advance Medical Directive, it is a legal document to sign that you sign in advance to say that in the event that you are terminally ill, unconscious, death is imminent, you do not want any life-sustaining treatment, okay, to prolong your life artificially. And a doctor is the one who helps you to certify that you are of sound mind when you sign the document. And this AMD only comes into effect when you are terminally ill, unconscious, and death is imminent. For LPA, this is a legal appointment of a person to make decisions on your behalf when you lose mental capacity. It involves a doctor who is accredited, a lawyer or psychiatrist who helps to certify that you are of sound mind. The LPA comes into effect when you lose the ability to make decisions for yourself. Okay, so how do you get started? So hopefully by now I've shared with you those questions, and now you've started thinking about what kind of values you have, what living well means to you, what gives your life meaning. And I'm sure during this circuit breaker period, you have started to maybe think about what is really important to you, what are the essential things that you realize that you need, or maybe the things that you used to take for granted, for example, being with your family, like being able to go out shopping, having a meal outside of your house, all these are things that I think we probably have started to realize are really important to us. We have a comfortable setting to share your thoughts with a loved one. Okay, this is an important conversation. You need to have time. You need to be comfortable. Both need to be comfortable. Okay, and always start slow. It's not an easy conversation, but it's really important. So give yourself and your family members some time. Okay, do not rush into the conversation. What you can do sometimes to start off is maybe you can share a memory from a previous hospitalization or a death of a loved one. Or maybe you can show them the ACP website. There's lots of very good videos to introduce this idea of advanced care planning. You can use a newspaper article. There's so much news about COVID-19, people admitted to hospitals, people dying from COVID-19. These are things that you can use to start talking about what living well means to you, what gives your life meaning. Okay, or perhaps you can use religious teachings. I'm sure lots of you are turning to religion these days in regards to the circuit breaker. Okay, so this is the screenshot of how the ACP workbook looks like. You can just go to the livingmatters.sg and download it. It's free. And after you have downloaded it, you can print it out. You can write in it your answers and share with what you've written with your loved ones. And subsequently, if you want to formalize your ACP, you can meet up with a trained ACP facilitator together with your nominated spokesperson. Okay, so this is just a quick slide to show how advanced care planning, LPA, and AMD comes together. And this is one of the slides to share on the resources that's available. I'd like to share a bit about this new website called mylegacy.gov.sg. It's a one-stop portal for you to organize and plan all these advanced documents that you have, CPF nomination, funeral wishes. You can upload and store your documents safely, okay? And you can also share these important information with people you trust. So it's quite a nifty website. I encourage you to go online and check it out. Okay, and if you have decided to have your formal ACP done, you can reach out to us at this number. Okay, so I'll just like to end off with these two quotes. It's when you learn to die that you learn to live. Okay? And talking about end-of-life choices is difficult. There never seems to be a good time, but we do not have to wait for a crisis before having the conversation. So I hope you can have the conversation now, today. Okay, thank you very much. Thanks so much. Okay, I think now we will move to the Q&A. I can see that there are quite a number of questions already. I guess we'll save the quiz for later. Okay, so question number 1. So if no one knows who is to use the AMD when the patient is dying, okay, that's a great question. So if the patient is dying and really the condition is irreversible and the patient is unconscious and the patient is on life support at that point in time, because remember, AMD is about saying that you do not want your life to be artificially prolonged if you are in that situation where you are irreversible, where your condition is irreversible and you're terminally ill. So if the doctor says that a patient is dying, is irreversible, and is on life support, the doctor then is obliged to look for the AMD, but it's not so straightforward to look for it. And sometimes the doctors may not actually look for it because at that point in time, they will use other ways to try and talk to the family members to try and let them know that life support is not very useful. So the AMD is not a very useful document at the end of it, but it's something that you can choose to make if you feel that you really do not want to be on artificial life support. You do not want to have your life prolonged if you were terminally ill. Okay. Question 2, if one is unconscious, how can one inform the doctors about the AMD? Yeah, so essentially you cannot. Okay, if you are unconscious, you are not able to talk, you cannot tell the doctors that you have an AMD, so they will not know. Unless you volunteered the information at the beginning before you became unconscious. Question 3, can I change my mind after an ACP discussion? Yes, you can, okay? And you should definitely review your ACP decisions. For example, you may have had previously said that if I were to, lose the ability to look after myself, I would like to be at home, okay, perhaps. And then subsequently along the way, you realize that, oh, you can't really manage looking after yourself at home. You have decided that you don't mind being in a nursing home or being in some sort of a care facility. You can change your ACP document. Question 4, is there a need for ACP if I have an LPA? Oh, that's a very, very good question. I would say that it's very useful to have an LPA because after all, that person, you have given him or her legal powers in regards to personal welfare or financial matters, and it helps make the life of that caregiver a bit easier. I have an example to share. I had a patient who had been admitted to a nursing home because he had Parkinson's and he had dementia. And unfortunately, he didn't make an ACP, he did not make an LPA, and his family members, I think his sister, because he didn't have any children, his sister was burdened with the financial aspect of maintaining his stay at the nursing home. and she couldn't tap into his CPF, she couldn't tap into his savings because she was not legally appointed to. So she had to go through a longer route to get the court to agree to let her tap onto his own savings and CPF to pay for his nursing home stay. So it's much more easier if he had already legally appointed his sister to be his decision maker in regards to finances. Okay. Can we reverse the decision after we submitted the AMD at the last minute? Okay, so you can make a reversal of your AMD. You just have to, send in the new form, you update it, or you can make a call, or even if you have changed your mind, you can always just tell your family members, oh, I've changed my mind about the AMD. But the problem is, if you want to do it at the last minute, then it gets tricky, because then who are you going to tell if at that point in time you are drowsy, you are unconscious? Okay, it makes it very hard to verify if that was truly the decision that you made when you understood everything, as opposed to a decision that you made when you were like semi-conscious or a bit confused. Okay, is it true a NHS is not needed? Okay, I'm not quite sure what this question means, but I suspect it's in regards to the advanced care planning. I would say that it's not something that we mandate, but we definitely encourage a person to nominate someone, because after all, advanced care planning is about planning for situations where you as a person may not be able to make your own decisions. So it's helpful to know who you feel you can trust, who can represent your values, so that the doctors or the healthcare team can then consult with that person if you were not able to participate in the discussion of what healthcare decisions you would have wanted. Okay, so a nominated healthcare spokesperson is very much recommended, so that the healthcare team will know who to approach to discuss things further if you are not able to take part in the discussion. Is the ACP document legal? As of now, it is not set in law, unlike the AMD and the LPA, but it is something that we do recognize is part of what the patient would have wanted. So it is still a very respected document within the realm of the healthcare team. Question 8. Wow, lots of questions. My brother is not capable of making his decisions. He is immobile. I understand I have to get the mental court order to execute decisions on his behalf. He is the co-owner. Wow, okay, this is beyond me. But I would say that unfortunately, if your brother is not able to make decisions, okay, he cannot apply an LPA right now. He cannot do an advanced care planning because he does not have the mental capacity. So yes, you probably have to go through the court-appointed way in order to get decisions made for him with you as the legally appointed person. So the court will appoint you if they recognize that you are indeed his spokesperson and you have been looking after him and things like that. I suppose yes, you probably have to do it through a lawyer. Yeah. So you see, that's why it's really important to do it now when you have the mental capacity, rather than wait for the time when you no longer can make the decision and there's a lot of trouble and burden on your loved ones. Okay, what happens if the client is alone and no family? Okay, there are situations where someone who has no family members, they appoint someone whom they trust, for example, a friend or a social worker. It's not very common, but it does happen. So that's also another option. In any case, the advanced care planning is more than just appointing someone. It also is about that individual's preferences and values, and all of which are very important. So even if that person is not able to appoint somebody, at least in the ACP form, the doctors are able to see what is important to that individual, and when the time comes, the healthcare team can make decisions according to what the individual values. Okay, number 10. Can you opt to have one directive and not others? If we consider all three to be beneficial, would it be better than all three are lumped together in one legal document instead? Okay, so that's a work in progress. I think our ministry is trying to sort of get these things together. That's why there's this new website, mylegacy.gov.sg. I would say that the ones that are, if you don't have time to do all three, or you feel that you don't want to do all three, I would say that advanced care planning is probably the most useful in regards to your healthcare decisions. So definitely I would strongly recommend for you to get that done. In regards to the legal appointment, I would say LPA is also very useful. CPM nomination as well, okay, and of course making your will if you have certain preferences on how you want your assets to be distributed. The EMD, I would say personally, I do not find it to be very useful at all. So yeah, that is my answer for the question. Can then ACP serve as an alternative for the legal to consider who will make the decision then? Okay, I'm sorry, I'm not quite sure what this question is asking. So maybe you could rephrase it and then I'll read it later. Number 12, can we settle all these forms at the polyclinics at the one sitting? Well, it depends if that polyclinic is able to get the ACP trained facilitator at that point in time. But yes, it's also a service that's available at most government polyclinics. So you just need to sort of, let them know that you want to get the ACP done. The LPA is also done by only doctors who are accredited or psychiatrists. So it depends if the polyclinic has a doctor there who's trained to make the LPA. Okay. Do we have to be sick to see the polyclinic? Hang on. Do we have to be sick and see the polyclinic doctor and after assessment? Well, if you are seeing a polyclinic doctor for your routine medical checkup, you can always also bring it up to them. You don't necessarily have to be acutely ill at that point in time. It's always best to get these things done when you're feeling well, you have the time and space to discuss all these matters. What if it is a single and can't find someone? Okay, so this one I already said, you can get someone who is not necessarily related to you, as long as someone that you trust and whom you feel knows you well. Okay, what about making a will? Okay, I didn't touch about that because, this is something that I feel that most people know what making a will is about. It doesn't so much have an impact in regards to healthcare decisions, and that's mainly the focus of my talk today, advanced decisions that have an impact in regards to healthcare. So making a will, not really. So that part, I would leave it to perhaps subsequent talks where maybe others can share about making a will. Where can I do my LPA? So you can make your LPA at most places like GP clinics, polyclinics may be able to do it, hospitals may be able to do it if they have the doctors who are accredited to do the LPA. Alternatively, you can get a psychiatrist to do it for you, if not then a lawyer. If I sign for AMD, then don't need ACP. No, that's not true because AMD is for a very, very narrow circumstance where your life is, you are imminently dying, your condition is irreversible, and you are terminally ill. Whereas for ACP, it covers a bigger range of conditions that may happen when a person loses mental capacity but is still actually not yet dying, still relatively well, just that they have lost mental capacity. So ACP covers a broader range of conditions. So I would say the ACP is definitely more useful compared to an AMD. So AMD, when should you make this? You should make this when you have the ability to understand and make decisions for yourself. Same thing as advanced care planning and appointing an LPA. All these advanced decisions, you should do it when you still have the mental capacity too. Okay. Can the person handle my LPA, misuse my money, example bank account? Okay, so that makes it important to make sure that the person that you have appointed, okay, as your donee is someone that you can trust. The Office of Public Guardian, they are also the ones who oversees the LPA, the donees, to make sure that they are making decisions that is in the best interest of the donor. So the Office of Public Guardian, they are sort of a governing body that oversees to make sure that the donee doesn't abuse the authority that has been given to them. What if my parents are not interested? Okay, if your parents are not interested, then get them. Perhaps you can start to share with them a little bit about what you have learned from this talk, and then perhaps you could, just gently, perhaps start sharing with them about the benefits of advanced care planning or making an LPA. I think people are wary about this topic because it is about death, and that can be quite a taboo topic. But I think once people see the value of it, especially in regards to reducing the burden, reducing the potential future conflict on your loved ones, many people will then realize the benefit of it and how important it is to get it done. My own parents have done their advanced care planning. Okay, question 20. I've pledged to donate my body for research. Okay, will the body be sent to the right party after execution? Okay, so that's a good question. Donation of body for research comes under another advanced decision. It's under the MITRA Act, and it's not covered at all under AMD or ACP or LPA. So that's a separate thing altogether. If you want to donate your body to science or research, it's under the MITRA Act. As an ACP facilitator, can we do our own ACP? So I would say that technically you can do your own ACP. I mean, if you download that Living Matters workbook, you can do your own ACP, you share it with your family members. But at the end of the day, if you want it to be formalized, if you want it to be uploaded to your national healthcare record, it's always better to have a third party to do that for you. I suppose sometimes if you are doing your own ACP, there may be certain blind spots that you have, and maybe certain questions that you may not have deeply delved into. So as a third party facilitator who is doing it for you, he or she may be able to better explore those other questions that you may have neglected. Okay, wow, there's so many questions. Okay, how does the donee know if the donor has made an AMD or ACP? So the donee needs to, so if you make an AMD or you make an LPA and you don't tell your family members, they will not know. Okay, obviously it's much better if you actually tell this to someone like your spouse or your adult child. For an ACP, usually as a facilitator, we will strongly advise that the nominated spokesperson is present during the discussion. If he or she cannot be present due to some reason, then after the ACP discussion with that individual, we will then perhaps arrange another session where the spokesperson is able to be there and will share with him or her what the individual has said. Or perhaps sometimes for myself, I will do it over the phone and I'll tell them, no, this is what your mom said, this is what your husband said to us when he was admitted to the ward. Okay, but it's not a good idea to leave the person that you have nominated in the dark, because then that's not useful at all. Okay, let's see. How do hospices, private hospitals know my AMD? Will I have to instruct a family member to show them? Yes, please do, because not all hospices or private hospitals have access to the National Electronic Healthcare Record. So if you, I'm sorry, that was about AMD. Okay, so if you have made an AMD, remember, doctors will not know about it. You have to tell them. They will not know unless you tell them. Okay, question 24. I have an LPA done last year. Do I still need an ACP? Okay, I'm glad that you've done and you have appointed someone as your LPA. I would still strongly advise for you to have an ACP done, because an LPA appointment means that you have appointed someone to make decisions on your behalf. But that person may not really fully understand all your values and preferences and what kind of decisions he or she needs to make in the future when you become seriously ill. So the ACP would be able to better let the other person know who you are as a person and what values and preferences you have. And this can really help them so much when they have to make a decision on your behalf. Okay, so yes, in summary, please still do your ACP. Okay, can my spouse be my ACP facilitator? Okay, I would say, I mean, that it's not entirely wrong, but I would still suggest, if possible, for a third party, if you plan to have this ACP formalized, like what I mentioned, ACP is just a series of conversations. It can be something that's very sort of informal if you decide to have it as a conversation with your spouse, with your family members, when you're having dinner together. But if you want to formalize your ACP, I would strongly suggest that you get a third party instead. Can a relative, husband or wife, give consent on behalf of the unconscious AMD patient? So in regards to consent for this, in regards to consent on behalf of an AMD patient, it depends on consent for what. If it's consent in regards to, a life-threatening illness, usually this is made by the doctor. But of course, the doctor will also consult the spouse or the family member. But the final decision in regards to life-sustaining treatment always falls back down to the doctor. Okay, next one. Can we include donating body to silent mentor in the ACP document? So you can mention that in the ACP document, but for it to actually be carried out, this goes under the Mitra Act, the one where you decide to donate your body to science and research. Okay. So you can mention in the ACP document, but if you want it to be enacted, you want it to come into effect, then you should make an application under the Mitra Act. Can I limit the person in charge of my LPA to what my needs are, or she can have all authority to do what she wants without my knowledge? Okay, so under the LPA appointment, you can appoint the person to make decisions in either one of these areas, which is personal welfare, which includes things like medical decisions and financial matters. So it can be either or both. If you want to limit the person, it depends on whether you want to limit them in regards to financial only or medical decisions only. It depends on what you want. However, I would say that when you appoint someone to be an LPA, if you have a feeling that he or she may not fully act in your best interest, may not always make decisions to your best interest, then perhaps that person may not be the best person to appoint. So once you have appointed someone as your donee under the LPA, he or she really does have quite a lot of authority to make decisions on your behalf in that area that you have appointed them. Okay. The only exception being they cannot make decisions in regards to life-threatening conditions or life-sustaining treatment under the personal welfare category. Can someone below 21 years old do an ACP? I think for now we have only allowed 21 years old and above because we feel that that's the age that you're able to fully understand and in terms of the legal weight, 21 years old and above is what we usually do for now. Okay, I see that's the end of my question. Okay, so now I will go to the quiz. Okay, I hope during the quiz you can sort of consolidate the information that I've shared with you. I mean, it's a lot of information, but thank you so much for staying through this talk so far. Okay, so quiz time. Okay, which of the following is not a benefit of planning ahead? Number one, to relieve burden on loved ones making decisions on my behalf, to have a sense of control of my future decisions in the event I lose mental capacity, to reduce conflict among loved ones making decisions on my behalf, to know exactly when I will pass away. So which of the following is not a benefit? Okay, I think this is quite clear. The answer is number 4. Okay, it's not a benefit of planning ahead. There's no way for anyone to know exactly when they will pass away. But the others are benefits of planning ahead. Okay. Appointing a person in a lasting power of attorney means, number 1, when I lose decision-making capacity, my donee will make decisions on my personal welfare and or finances. Number 2, when I'm seriously ill and in a life-threatening situation, my donee will decide whether I should get treatment. Number 3, when I passed away, my donee decides how my assets are distributed. Number 4, my donee will make decisions on my personal welfare and or finances, even when I still have mental capacity. So this is a bit tricky, but the answer is number 1, okay? Because the person that you have appointed for option 2, they cannot make the decision when it comes to serious illness and life-threatening situations. The doctor is the one that makes that decision. The donee does not decide how your assets are distributed. That comes under when you make your will. And if you have mental capacity, your donee is not allowed to make decisions on your behalf because you still have mental capacity. The LPA only kicks in when you have lost your mental capacity. Okay, which of the following decision tools pertain to your health? This is very easy. Okay, and the answers, more than one correct answer, and these are the answers. AMD, ACP, and LPA under personal welfare. All these pertains to healthcare decisions. The Advance Medical Directive can only be applied when a person loses mental capacity, when a person has a serious illness like cancer, when a person is admitted to hospital, or when a person is terminally ill, unconscious, and dying. Again, a very easy question. I've covered this before. This is the answer. So AMD can only be applied in a very, very narrow circumstance when a person is terminally ill, unconscious, and dying. And if they've signed the AMD, it means that they do not want to have their life prolonged through artificial means. And this is certified by 3 individual doctors. Okay. So only in this narrow situation, if a person has signed an AMD, if the person is also on life support at that point in time, the doctor is legally obliged to take off the life support. Okay. Advanced care planning is a useful tool because planning ahead is an opportunity for me to better understand my medical conditions. It is where I can nominate someone who can be my spokesperson when I lose mental capacity. It guides me to share my values and preferences that will guide healthcare teams to make decisions on my behalf when I lose mental capacity. It is where I can share my funeral wishes. It is where I can share my decisions on asset distribution. Okay, this is it has more than one correct answer. Okay, so the correct answers are these 4. Okay, yes, in the ACP form, you can also share your funeral wishes. Okay, but usually in regards to asset distribution, that's not really where advanced care planning falls under. Okay, advanced care planning pertains to medical decisions as well as decisions in regards to end-of-life care. The person whom I nominate as my spokesperson must, number 1, be willing to respect and honor my decisions, my wishes and preferences. Number 2, be my spouse. Number 3, be someone who can be calm in times of crisis. Number 4, be someone who knows me very well. Okay, so the correct answers are all 3 except number 2. So it's not necessary that your spokesperson must be your spouse. Sometimes I have some patients, they decide to nominate their adult child. Perhaps for those who have no family members, they can nominate someone they trust, for example, their friend or their medical social worker. Okay, I think we've come to the end of the talk. I hope that you have found this talk useful. I apologize if if I was going too quickly towards the end, but I'm really encouraged by all the questions that you have typed in the Facebook comments. Again, if you are looking for an ACP facilitator to hold a formal ACP discussion with you and your loved ones, please contact the numbers below. At the present moment, because of the social distancing and things like that, we are not able to have all our outpatient ACP sessions, but once we get the chance to, we'll definitely get them started. And I hope that you've enjoyed this series of talks. Please like and follow the C3A Facebook page so that you can continue watching the interesting contents that we prepared and shared with you all. Once again, thank you so much, and thank you to National Civil Academy for giving me this opportunity to share with you all about advanced care planning. Hope you guys have a great day. Stay safe and keep well. Thank you.